We are going to do in about 60 seconds is interview Dr. Suah of Foxhall Dermatology, who's actually here. Let me go ahead and request that he our live feed. Hello
Hello,
there.
how goes it?
How are you?
I'm doing well. How's everything been going this morning?
So far, so good. So I have to tell the world, Dr. Suah is my dermatologist, and I always see his hair in a bun.
Yeah,
I knew he had gorgeous curls because I looked him up online, and I've never seen them out. So your hair looks phenomenal.
yeah, we're out
You definitely
today.
got to tell the world. I'm disappointed we can't take credit at Thrive Hair Bar. We didn't do your hair, but it still looks amazing.
Thank you.
Um, and that's a whole nother story. But I guess you can introduce yourself to the
Yeah,
world. I kind of did already, but go ahead for it, Dr. Swab.
yeah. So I don't know what you've said already, but basically, I'm a board certified dermatologist here in the DC area. Obviously, or maybe not obviously, I'm not sure what you said. I trained at Howard University, the Mecca of skin of color. And a big part of our dermatology training is hair and nail biology. So, I mean, we have to pass exams for boards. We have to learn everything inside and out about, unfortunately, hair loss, but just hair growth, regeneration, all of these types of things. Howard, we have the benefit of on skin of color, hair of color, and things that kind of, I don't want to say plague, but can be very persistent and higher occurrences in our community specifically.
Yeah. And I love that you started talking about the research that you have to do behind hair, skin, and nails because a lot of people, when they think of dermatology, they think skin. They don't think nails,
Yeah,
and
yeah,
definitely don't think hair.
yeah,
And I even got the question. I'm like, oh, we're interviewing leading dermatologist, Dr. Suah, who's at Foxhall Dermatology here in the DMV area. People are like, oh, that's cool. But you could see in their face they were confused as to why.
yeah. They're
I'm
like
like, because he
fun.
specializes in scalp and hair and can help talk about some of the reasons that we see so much hair loss in the Black community and ways we can maybe avoid it, prevent it, and treat it. And that's kind of why I wanted you here today to talk to us about some of that, some of the things that you see at the practice, some of the things you wish you didn't see, and ways to avoid
Yeah,
seeing it in place.
yeah. So I
I
mean,
guess
uh, go ahead. Sorry.
Oh, no, no, no. Before we jump into all the things we want to change in the world, I would love to hear your hair story. So again, I've never seen your hair out, and I did see your photo on LinkedIn. I was going on LinkedIn now. Your hair's short.
Oh
You
yeah,
have like a
yeah.
buzz, and now you're rocking these gorgeous locks. So curious to know what your hair journey was and why you're growing out your hair.
That's an amazing question. So I am the son of a Jamaican, born and raised in Kingston, Jamaica, and so even from a young age, I was always interested in kind of the hair journey that comes with locks and the Rastafarian faith specifically. But kind of in the culture that we're all trapped in growing up, I never really explored kind of what my natural hair looked like. I kept it short. I kept it clean, like everyone else. I had the Caesar cut or the low fade, and even now I'll get it cleaned up on the sides. But I think it was after I finished my residency, and so this is you go through 12 plus years after high school of training and kind of finding yourself, and I was like, man, I've done all these things to kind of fit in and follow the trends and kind of what I've seen around me and been told to do or thought was what I had to do. And I was like, let's kind of find myself and see what I'm all about. And so in my journey to just kind of growing and developing as a man, I started to grow my hair out and kind of get back to my roots and some of the things that I was always curious about as a child. And I just started to grow my hair. I had no idea what would come of it. I didn't know if it would be brutal, um, or if it would end up being something that I loved and enjoyed. And there were plenty of days where it was brutal, but it's been an amazing journey. Learning how to take care of my own hair appropriately, how to grow it out in a healthy manner, and there's a lot that kind of goes into all of these things.
I
You know,
absolutely thank you so much for sharing that story. It's
yeah,
I don't have the Jamaican background, but it's similar in that I didn't know what my hair would look like when I stopped relaxing it and allowed it
yeah,
to kind of grow into its nice state. I was like, oh, let's see what happens, and let's
yeah,
figure out how to take care of this, because I had only been taught to take care of relaxed hair. And so that is a journey
of
that
course.
so many naturals can speak to, because they've gone through it as well. And it's interesting that you, as a professional in the field of hair, skin, and nails, went through it as well. It's
Yeah,
almost
yeah,
important that you went through it as well. You're talking to us about what to do and what not to do. It's not theoretical. It's, hey, I went through this myself. And
yeah.
speaking of
It is
like
a
things,
nice added
what to do and
benefit.
what not to, yeah. So as a dermatologist, especially as a leading Black dermatologist, what are some of the things you see when people come to you? What are women coming to you for when it comes to their hair?
Yeah, so it kind of runs the gambit. Specifically in the Black community, what we run into is a lot of damage just from our hair care practices and kind of, the Europeanized version of what we think our ideal hair is supposed to look like to be socially and culturally accepted. And so when patients come to me, unfortunately, a lot of times it's after kind of like you were describing with both of us, years of just kind of damaging our hair, doing different things to our hair because we thought that's what we were supposed to be doing to our hair. And then when they walk into my office, sometimes they look at me as, the saving grace and, what can you do to fix this? And I think it's really important that we focus kind of on the front end of these things because sadly, a lot of patients come to me and there are tough conversations that I have to have with them about the damage that's already done. And in fact, sometimes that we're not going to get our hair to return to that, all because of just how we kind of treated our hair throughout our lifetime. So I see things that kind of run the gamut from early on when there's plenty we can do to really, really improve, get full hair growth back and everyone is happy. Those are the happy days. All the way to the other end of the spectrum when we have to just be realistic and sit down and have tough conversations with patients about the long-term sequelae of kind of what we've been doing to our scalp and our hair our whole lives.
What are some of those things? So, based on my conversations with you and some of the reading that I've obviously done to prepare for Thrive Hair Bar, I hear that like traction alopecia is
Yeah.
something that's pretty common in Black hair, and that's a type of alopecia that you can avoid because it's and you correct me because you're the expert, but it's caused by things
Oh,
like too tight braids, tight ponytails, or heavy extensions. So, what are some of the things that people are doing that's causing not just traction alopecia, but maybe some other things that we don't know about that they can avoid to keep the hair on their head?
that's a great question. So when we're talking about specifically black hair, there's a number of different types of hair loss that we're talking about. The most common, or one of the most common things that we see is traction alopecia. And traction alopecia is just a fancy way of saying the hair follicles have been under too much tension for too long periods of time. And at the base, that trauma has actually caused the hair follicles to break, to shear, to retract down and get smaller in many times, or what we call miniaturized. And that's when you start to see along the frontal hairline in a lot of women and men as well, kind of what we call the fringe sign. So the fringe sign is just a fancy way of saying we see these kind of small, almost what look like baby hairs, and then slightly behind that zone is we see actual alopecia or hair loss. And then we see the hair kind of back in the tight style then behind it. And so what has happened is over time, when the hair has been pulled on, brushed through, people have been slapped for being tender-headed. We're actually just
Me.
pulling, yeah, we're actually just pulling out and damaging those initial roots. And the next time, we just keep tightening it down again. We keep tightening it down again, and it just keeps working the hairline further and further back. And what the fringe you're seeing is actually the break along the frontal hairline just from that long-term trauma and tight hair pulling on it. It's really just weight. Even long dreadlocks and things like that can cause it. So what we recommend in the field, or what I recommend to all of my patients, is one, it's obvious, right? We're not going to want any type of hairstyle that's going to be too tight, that's going to be pulling. on any part of the scalp, whether it be from the side, anteriorly, which is usually where it is, even from the back, sometimes we see it. So looser hairstyles, changing our hairstyles more frequently. So if we do have longer, fuller hair, that's going to be weighing down and pulling to the back, even dreadlocks, changing up the way we wear the dreads along the scalp and what direction you wear them is also equally important, because you just don't want that constant force always being in the same direction, pulling on the same line of hair, basically.
That's extremely helpful. And I love hearing that from you. I want to talk all my elders, and I won't name names, who, did my hair as
Yeah.
a kid. And it has to be tight to last. Or if I moved a little bit and said that hurts, they'd smack me in the head. And I was like,
Oh
whoa,
yeah.
I'm in
It,
pain. I feel like if I could show them this video and see, I told you, it hurts, it won't
yeah.
supposed to hurt. But I want
Yes.
them because they were treated the same way by their elders. So we've been like
Yeah.
perpetrating this, like, leave this style in for 3 months. Don't move your head.
Yeah.
It's tight. Your head's bulging. That's okay. You're just gonna sleep and don't move when you sleep. Kind of.
Yeah. It's tough. It's tough. It's tough to get away from those things.
Yeah, it's because it was wrong, and,
Yeah.
and we shouldn't be
Yep.
doing that anymore.
No.
And I love that you shared kind of to avoid it in the first place and or start to treat it. It's just, it's not rocket science. It's
No.
dermatology,
No. It's not.
looser styles.
Yeah.
Um,
Yeah. Yeah. It's just
right.
hearing it. More people need to hear it. It's basically what we're getting at.
And then when it comes to those of us, so some of us have, like what you said, some issues with wearing tighter styles traditionally, and maybe some traction alopecia. And then there are others who, hair is not just what you do to it; it's also what you're eating, your genetics, right? There's quite a few things that can surface themselves and speak to your scalp and hair health. So what are some things people can do in terms of, maybe talk a little bit about genetics, like how that plays a role, so we can be realistic about our hair goals?
Yeah, no, that's a great question. And so there is a specific type of hair loss in the African American community that we call, it's a very fancy term, central centrifugal cicatricial alopecia. Unfortunately, we used to also call it hot comb alopecia, and we used to think that it was just totally based on hair care practices. We used to think it was all about how much heat we were putting in our hair, and it was causing this type of hair loss, specifically what we call the vertex of the scalp. So the top of our scalp is where it happens. And although those hair care practices do play a role in it, and I don't recommend any of them, we're also finding out that there may be some portion of it that maybe have a genetic component to it as well, meaning we found some women in Africa who did not undergo the same hair care types of treatments that we do so commonly here in the US, that were having similar types of hair loss. And so it's important to understand our genetics and where we come from and what things we are more predisposed to, because the earlier that we get them evaluated, right, the earlier that we can stop the process. We can improve the hair loss. And so with that specific type of genetic hair loss, basically the common symptoms that women are going to have is actual tenderness, actual itching on the scalp, but it's going to be very focal. It's not going to be like this generalized dandruff if your hair's been in the same style for too long, or you haven't washed it recently, that we all get. It's not going to be something like that, or just mild itching kind of generalized. It's really, really going to be focused on what we call that vertex of the scalp and the top of the scalp. And you're going to go, I'm not losing hair anywhere else. I keep losing hair here. I keep having itching here, and I keep having burning. Sometimes it can be described as well. And so that's something that you need to go see a dermatologist immediately, because there are a lot of different treatments that we can do early on to kind of stave off some of the hair loss, and also make sure that any hair that has been lost can return. Because in hair loss, we think of two big categories. One is scarring and one is non-scarring. It's just a fancy way of saying the hair follicles are gone and we're never getting them back. Or there's still some hair follicles there. They've just kind of miniaturized and went under the surface, and there's chance for regrowth. So we don't want to end up in the scarring. And the scarring is kind of, if we just ignore these symptoms that I talked about for years and years and years, any type of process is going to end up here. And you're going to come talk to me, and I'm going to have a very long, tough discussion with you about where we go from here.
Yeah, and
Yeah,
that's the thing that we want to. We don't want to take any
absolutely.
business away from you,
No,
but we
no,
want to
trust me. If
avoid
I can
having
avoid
this
those
tough conversation.
conversations, Yeah. Much better life for everybody.
And then I guess speaking of people coming to you for tough conversations, I did tell the world you're at Foxhall Dermatology here in
Yes.
DC, but what do
Yes.
you typically, people coming to see for, it doesn't just have to be hair because you are a dermatologist, you got great skin too. So I'm sure people see you for all types of things, but what are the things that people come see you for, Dr. Swell?
Yeah, so I'm a general dermatologist. I can see you for basically any skin condition that you may have, from psoriasis to eczema to hair loss. I also am a cosmetic dermatologist, so we have a ton of lasers, as you've seen in our office. We do all of the fillers and Botox and skin care to make us all look beautiful and stay young and healthy. So we really are comfortable with kind of the gambit, and we do, of course, treat hair loss. We take it very seriously. It's something that really, I think, kind of things like this and more education and more places like Thrive Hair Bar will be really helpful to me in the long term, because not just coming to see me, right? I'm part of hopefully the solution, but there's a lot of other avenues that patients and people need to seek to really keep their hair on the right path. And I think it's always good to have people in the community like you that are advocating for people to really take care of themselves. That's what it comes down to. We're told that we have to check X, Y, and Z throughout life, and our family reinforces that, society reinforces that. But I'm telling you, if you only are a science person like me, the science does not stand behind that. And so we really, really, really need people like you in the community that are really ahead of the game, ahead of me, before I can reach, you can reach more people than I can, specifically on this one. So I think it's really important.
Yeah, I obviously share that sentiment, and that's why we're out here. We really want not only to send people home with beautiful styles and feel good, but help educate people on how to maintain their hair, keep it on their head, and normalize the wearing of your kinky, coily, curly hair in every single setting in the world. It's the way it grows out of your head, so
Absolutely.
why are you not just flaunting? And speaking of flaunting, I actually come to you for the past, what, 4 months, I think? 6 months?
4 months, yeah, 5 months
Um,
maybe, yeah.
about 4 to 5 months, because you've been
Yeah.
helping me with my hair, and you've been
Yeah.
doing PRP, and I will let you describe what that
Oh,
is.
yes.
And
Yes.
Dr. Patient confidentiality, but I've shared it already that I've been going to you for PRP. It has worked because I love my hair so much. But anyway, I'll let you describe what it is, and it's the service that I've done, and I vouch for it. But yeah, go
Yeah.
ahead.
So yes, yeah, PRP is great. PRP basically stands for platelet-rich plasma. It's just a fancy way of saying we take our patient's blood and we spin it down in a centrifuge and we get out really, really high quality growth factors from your own blood. So it's not some exogenous source. We're not pulling it from somewhere else. This is you. It's all what your body is already capable of doing. We're just harnessing that benefit, and we're then re-injecting it right back into the scalp. And so platelet-rich plasma is great for all kinds of hair loss. Even early stages now, they're starting to see for like that CCCA I was talking about earlier, some benefit in earlier cases where we can get regrowth, whereas before we thought some of the scarring alopecias, it wouldn't be very beneficial. But it is something that definitely helps with traction alopecia, along with a ton of other treatments. But it like I said, it's basically your own growth factors that are then re-injected into your scalp at specific areas, as you can attest to, that we kind of want to focus on, right?
Yeah.
And the benefit of these growth factors is it will start to stimulate the follicles that are miniaturized under the surface to start to mature, grow out. It will strengthen, I think, is one of the things you and I talked about, even the hairs that are on your scalp already. So you'll start to notice less hair loss. It's a treatment that we do once every month for 4 months consecutively. And then after that, every 6 months or once a year, we do kind of like a series of just one injection, really, to kind of boost and make sure that everything is still on track. But that's pretty much PRP in a nutshell. It's just taking your own good stuff and putting it where we want it to work, basically.
Yeah, and I can attest that you're correct. I've been going there for 4 months, and it helped a lot along my hairline, and definitely as well with the center of my hair. I used to be one of those people who only went outside I was in a weave or wig. And so I was experiencing so much breakage from neglect. And since I've started going to you and also been taking care of my natural hair, like, it's less dry. I see less breakage. Like I'm
Wow.
not a person who likes to slick my edges down, but I have edges and they're here, which is nice to have. So
Yes.
if that's something that you guys are considering as you're watching out there, do your research. Go to Dr. Suah, ask all the questions. Again, he is here in the DMV area. And I guess, Dr. Suah, is there anything else that like you want to share with people that we haven't already discussed?
No, I think you're doing a great job. I think, the most important thing is that we get the word out and we start from when we're very young, I mean, I think that educating our community on hair care practices that are healthy for us is really, really vital to kind of the longevity of one, just people's, right? But I think you and I discussed it a little bit yesterday when we talked for that short little brief minute. Everyone really, really associates their identity a lot of times with their hair, whether it be completely valid or not. It is a portion of our identity. And so keeping that identity, being confident in who you naturally are, I think psychologically is amazing, rather than having to constantly feel like we are for the betterment of others. Something can be said to that. For just overall health and mental health and things like that. So it's deeper than just hair. You know what I mean?
Yeah, no, it definitely speaks to my soul. And I don't want to let you go because I got to see you once a month for 4 months and now I don't need to come back for 6 months. So I'm going to come in just with random issues. Just, oh, there's a
Just
pimple.
find
Or
some stuff.
I have one.
Yeah.
I'm just going to find things wrong so I can come in and visit more often. But
Yes,
I
you're
would
always
love
welcome.
to tell everyone. Thank you. And we got to get you in the salon as well,
Yeah,
so that
definitely.
we can claim so for those beautiful locks you have on your head. Can you tell the world just where people can find you, the best way to contact you in your practice,
Yeah.
and where
Thank
maybe to
you.
follow you? Have any? Yeah.
Yeah, thank you so much. Yeah, so I mean, our office is in what's called Spring Valley in Northwest DC, at 4910 Massachusetts Avenue. Our phone number is 202-695-1000. Just give us a call and we'll be happy to get you scheduled for consults or just to discuss hair issues or really anything else dermatologic as well. And on Instagram, second generation skin is my Insta, like you can see here. It is just an ode to my father, who's also a dermatologist down in Florida.
I love that, all the generations of doctors in your family. Well, Dr. Suah, thank you so, so much for joining us this morning
Of course,
for our
Ajia.
grand opening. I appreciate it 10 times over.
Of
And
course,
I
of
will
course.
chatting with you. I'm on my issue for that one hair that broke that I'm gonna need you to
Yes.
fix.
All right. Thank you for having me, and thank you so much, honestly, for what you're doing for our community. It really is important to me.
Of course, and I'm happy to do it because I agree with you. And thanks for all you do. Enjoy the rest of your
Of
weekend.
course. Thank you. You too. You too. Bye.
Bye.